The book I'm reading, The Woman with a Worm in Her Head and Other True Stories of Infectious Diseases by Pamela Nagami, who's also a medical doctor. I'm reading her next chapter, which is titled The Woman with a Worm in Her Head. I finally finished a chapter, and I wanted to finish a chapter because obviously she named a chapter after the book, or she named the book after a chapter. I thought it would be somewhat important. That I would maybe get most of the information out. So, if you did not see my last two videos, I will get you up to speed. There's this woman named Danielle Jordan. She is like sort of a businesswoman. She's like a salesperson, someone who helps people get advertisements, and so a big part of her job is talking and speech. And one time when she's talking with someone else, all of a sudden her words start slipping out of her mouth, and eventually she just can't talk. But for some reason, she's able to write. So she writes call my parents with it, and then all of a sudden she starts having what looks like to be a seizure. When the parents come back, eventually her voice and her ability to speak comes back, and she goes to the hospital. And when they check it, there are several different diagnoses that are given, although none of them are actually correct. And most of them are when they take their MRI, they notice next to in her brain, right above one of the ears, there's like a small mass that looks like to be a tumor. And one of the doctors said this can be easily removed because it's so close to the surface. But the problem with it is that it's over the speech part of the brain, and so removing it could potentially ruin whatever is left in there. Because once anything or anything that goes inside the brain destroys or burrows through, it'll start killing adult nervous cells. The problem with this is that since the adult nervous cells are adults, they don't have a need to multiply anymore. Thus, every single nervous cell that you kill is permanently killing it. That it's something that you won't have back, such as like if you cut yourself, or don't cut yourself, but like if you get cut, for example, your skin will eventually come back because the skin cells, the muscle cells, they will eventually find their way to multiply again. So, eventually, she's having a talk with her doctor, and after they look through it, one of her friends' wife, whose husband is actually a neurosurgeon. The neurosurgeon looks at the X-rays done from the MRIs done from other doctors and looks at it and says that he doesn't see a tumor, but he sees a kind of worm, which is a big relief. So instead of having such of a tumor, it could be a worm, which is not as bad and actually might be curable in this case. So eventually, she goes to many more doctors and eventually goes to the author, and which later reveals that what she has is actually not rare, and that if she didn't give her last name and was not given by name, that probably would have been one of the first answers that she would be given, one of the first diagnoses. But because her last name is Jordan, which is kind of more American, that the kind of tapeworm that she has is not very, very uncommon, because it's partly inside like uncooked meat, for example, or unsanitary food. And eventually, after 6 years, she developed the worm. She got the worm, and the worm started causing more problems. So, looking back at her history, she was born and raised in New York, and then moved to California when she was 6. But they have been regular travelers to Mexico, which is a high risk rate of the tapeworm that she has, which is Cysticercoccus. And the doctor explains that it is not 100% exact, but you need to make a decision. Would you want to go right in and take the surgery, knowing that you could damage your ability to speak, or wait several months and take medication and to see if it really is a worm or if it's a tumor. And knowing her as a businesswoman is a big part of her job, so of course she takes the medication. But then this is kind of worrying her, because what if she was wrong? Just like most doctors, I'm assuming that they always go for what if I was wrong kind of thing. And so she takes her blood and she sent it to a lab, and eventually when it came back it was positive, which was a good thing. But the chances of her harboring the worm were for at least 6 years, because having a worm, Cysticercoccus, if it's inside the head and it was as big as it was at the time, it should have been at least 6 years, so that thing has to be growing and growing constantly. And this is actually kind of surprising and ironic, because it was actually forbidden by her religion to eat pork, and she was finding herself a host of a pork tapeworm larva. So eventually the doctor starts talking on about how Daniel's appointment was the next morning, but then Friday night she had a bunch of work to do, so the next morning she was pretty tired and had a bunch of errands to work on. And later she talks about how she was working in a unit where a nurse all of a sudden ran out of one of the rooms and called Code Blue. Now, Code Blue is an emergency. It is something that nurses or anyone calls in case of an emergency if a patient is suffering from a cardiopulmonary arrest, which then thus is in need of a specific team, sometimes called like a code team, which immediately begins resuscitating efforts to get the heart back into beat. So, and then later in the chapter they soon talk about the treatment that should be done. So an ophthalmologist is supposed to be checking her eyes to make sure that there are no larval worms in her brain. So that also makes sure that it's only one worm that's in her brain rather than several. And then also give her first rounds of anti-worm drugs in case the parasite in her brain was had an increase in chance of having a seizure. And then finally given Decadron, which is a corticosteroid medication, which is used to minimize the swelling that is caused by the parasite. But the problem with this is that Decadron could also decrease the concentration of the worm medicine in her brain. So this is kind of a gamble that the doctors were doing. But this kind of like treatment was given not by Pamela Nagami herself, but from a different team, and they're trying to make this gamble, which eventually did work. Daniel eventually did get better, and this was kind of nice. So for someone with only one Cysticercoccus worm in their system, that their treatment was working, that was pretty good. And eventually she returned to work, and they have finally discovered that she had parenchymal neurocytococcus, because obviously it was in the head. And basically what happened was a tapeworm egg somehow found its way into her bloodstream, and thus eventually got lodged into the brain. And which is good that it was only one egg, because if it was several, in patients with more severe cases of neurocytococcus, the brain would look exactly kind of like Swiss cheese. So just just imagining there's several holes inside the brain. And near the very end of the chapter, Daniel starts talking about how she's completely forgotten about lunch when she was in Puerto Vallarta, which is in Mexico, which was maybe 6 or 7 years before she started getting sick. And she was traveling there, and she should have known better, but she did something that she'd never ordinarily done. And the doctor asked what was that, and she said she ordered a salad. And the problem with the salad is that it could be unsanitary, especially in Mexico, and thus having her get the tapeworm inside her, getting her the worm inside her head. So yeah. And that's where I end my video.
Okay, so what is the morality for you in order to avoid to get something? How could she have avoided besides ordering a salad?
Besides ordering that, you could still get parasitic worms or any other parasitic diseases if you eat uncooked meat, perhaps, or eat maybe something that seems kind of unsanitary. Like, let's say you're having a fruit and you maybe just found it on the ground when it just fell off a tree and you eat it. That might not be insanitary because you don't know how long that apple's been on the ground, and you don't know if under that there was perhaps feces, or there was maybe the parasitic worm just crawling around, or maybe there was just different other kind of insects that was in there, and maybe they entered. There's a whole bunch of stuff, and that's why you should maybe wash your fruits before you eat them, like apples or oranges.
You think it's because they did not wash properly the salad?
That's probably what. Maybe when they got the lettuce inside, they probably didn't wash it properly.
Okay, so what do you think about first they thought that she had a tumor?
Yeah, so first they thought she had a tumor because when they took the MRI, they saw an abnormality inside her head that was pretty close to the surface of her skin, and right above one of her ears, which is kind of the same area where speech is sort of created and connected to the brain, so then you can actually start talking, right?
Oh, so...
But apparently, the funny thing about that is it doesn't stop all communication. What she was saying is that for some reason she was able to call my parents while she was having some baby talk, because she couldn't actually form words, right?
Does it remind you something else that you did listen here?
Yes, I think so.
So do you remember the people trying to draw a star while looking in the mirror?
Yes, I don't remember what it was called.
The lady that could not count to 10. Do you remember that?
Yes, I know.
So yeah. So that's an area. Well, basically,
that's the area of the brain that is being affected, right?
By the yeah.
Okay.
Exactly. Yeah. So okay. So they thought that she had cancer first, and then.
Right, because they saw a tumor.
Okay.
And then eventually, one doctor, putting the MRI or X-ray sheets into the light and looking and saying, "I don't see a tumor, I see a worm."
Okay, and the other thing is that the worm was doing well, or it was dying, or how come the human system, the body?
So the only reason
human system could not find it.
So the only reason it wasn't doing anything was because how it wasn't doing anything because the larvae was alive. But basically what the worm does is that it's waiting for the host to be eaten by a predator, so then it can enter to that predator as a host. But the thing was, it finally realizing, okay, this host is not going to be eaten by another animal, so it kind of was dying, and as it's dying, it's causing problems for the brain. And that's why she was in this area, she wasn't able to speak.
Okay, so the human system could not detect the larvae? Or could it?
No, it couldn't.
It could not, because it was not dying, or?
Well, yeah, it wasn't doing anything if the immune system was. If the immune system did see it, though, it probably would have. I'm probably sure that the worm would have started dying maybe a year or two At least.
Why he could not see it?
At most.
Why the human system could not detect it as a foreign element?
I'm not actually sure, but I think that's a. I think she did say that, but I'm not quite sure at the moment. But yeah, maybe that was in the second time. But yeah.
Okay, so what did you like? What did you like the most then? In conclusion from all of this, what did you enjoy the most?
I think I enjoyed sort of the idea that and she was saying this in the book, like how a patient kind of knew, like she was saying that Daniel sort of sensed that she had some complex problem that was going wrong with her, and so she wasn't afraid to consult with several different doctors, because if she stuck to the first doctor they would have thought it was a tumor and she probably would have died. So it was a good thing she was making all these connections, going to different neurosurgeons.
The most then?
Yeah, sort of. Yeah, I kind of like that idea.
Okay.
So like, I don't know, if I'm sick again, and I feel like it's something that's like not necessarily normal, I mean, I probably wouldn't do the same thing.
Okay, then you learned something. Okay.
Right.
That's good. Thank you.